GR IAS Academy.
100 days, 100 themes, 1 goal UPSC Prelims. Hello everyone, welcome back to Mission Surya. In this program we deal with current affairs completely from prelims perspective. So let's get started. So today we are discussing about budget 26-27 and its spending on healthcare sector. So even though health allocation has increased 10% with respect to the previous year, that is total allocation is 1.5 lakh crore, still it is very less even than the targets in the earlier 2017 plan. So it is only 0.26% of GDP and 1.9% of government expenditure. So it didn't even realize the targets, okay, where the target is 2.5% of GDP. So India's spending on healthcare sector is very low when compared to other countries globally. And in this budget, even in the healthcare sector, it is concentrating more on the innovation-led infrastructure and research. So they have allocated resources to Biopharma Shakti scheme around 10,000 crore, and they have sanctioned for 3 new NIPERs and upgradation of 7 NIPERs, and they are also taking care of that affordability by exemption of duty and focusing on rare diseases. Okay, and what are the measures they are taking? Okay, in this budget primarily they are focusing on ecosystem for innovation, right, and innovation and research. So in case of biopharma, medical infrastructure, and for medical value tourism and workforce development in case of health sector. So there are few concerns as well, like even though the budget is 1.5 lakh crore, it is only 0.29% of GDP, whereas the target was 2.5%, and it is very low when compared to the other countries globally. Okay, and there are always universal healthcare challenges are also there. And what do you have to remember for the exam here? The health allocation is around 1.5 lakh crore, share in GDP is 0.26%, even it is very low when compared to the targets of 2.5% GDP, and also when compared globally with the other countries. And for in this 1.5 lakh crore, they are allocating 10,000 crore on Biopharma Shakti plan, and they are expanding NIPERs, 7 NIPERs and plus 3 new NIPERs, right? And then NIMHANS 2.0 is also on cancer drugs. They are exempting duties, and overall budget is focused on innovation and infrastructure is greater than the focus on primary care. So that is what you have to remember. So it is like a more or less pattern, more for innovation and infrastructure, less for the primary care. And then comes our next topic, inclusion of technology in our healthcare. Okay, so AI is integrated how? Okay, we are focusing on universal healthcare and accessibility of healthcare to every person, and for this they have launched India AI mission. In case of policy, Niti Aayog AI strategy 2018. So India AI mission, it has been allocated this much crore, and keeping the values of democratization and treating healthcare as a public good, India's AI mission and other policies were framed. And overall it is like a more and less pattern. So budget allocation is more for innovation and tertiary care and less for the primary care. So we need strong foundational systems. And in case of AI in public health, around this many teleconsultations have been done, and in case of TB, because of inclusion of AI in the technology, there were 20% reduction in the adverse outcomes, and for detection mechanism has showed progress of 12 to 16%. So that is the positive response because of inclusion of AI in the healthcare sector. And then applications of AI in healthcare. For TB, deep XCR, and for diabetes, telemedicine surveillance, they are used in many identification of diseases, and for cure, and for monitoring and detection of fraud. So in every sector, AI is helping us to maintain democratization of the public good. So there are few institutions like AIIMS Delhi, PGMR, Chandigarh, AIIMS, Rishikesh, and few other institution mechanisms which are using AI and AI in health sector. Okay, and then in case of digital infrastructure, they have developed ABA mechanism, wherein you go to a government hospital, register for ABA ID, and from then onwards you can directly register for your token from your home, right? And then you can directly go to the token section and give this number. You can skip the queue. So that is how they are developing the infrastructure and accessibility by inclusion of digital infrastructure in our healthcare sector. So there are certain innovations under AI mission. So the examples are Nidan for TB detection and radiology cloud platforms. For joint health, there are certain wearable devices for diabetic eye screening and cancer detection devices. So we have already seen that 15 to 16% of TB detection cases were, 12 to 16% TB detection were better. Okay. In case of private sector also, they have done some innovations in the AI digital healthcare. So few are here like Q.AI, NemoCare, CareNX, and Thermalytics, especially for breast cancer screening. Okay, AI powered stethoscope, and portable eye screening device called Trinetra. So there are few innovations in private sector as well. And what do you have to remember here for the exam? Indian AI Mission 2024, around this much crore has been allocated, and it is used for TB, diabetes, cancer detections, surveillance, and telemedicine as well. E-Sanjeevani, around 282 million consultations have been done under digital in healthcare. AI based outbreak alerts were also given. ABA ID, right? And then MIghty guidelines plus ICMR for using AI ethically. And then AI supports One Health cards and universal healthcare goals. So that is what you have to remember for the prelims exam. And then comes health schemes. So Ministry of Health and Family Welfare take care of the health schemes. Their focus is mainly on primary care and to protect the people in case of financial issues for taking care of health, because most of the Indian households, they spend their income on healthcare because of the sudden onset of diseases. So they want to reduce that burden on the people and provide the infrastructure and promote digital health by using many digital schemes. The first one is Ayushman Arogya Mandir. In this, 1.81 lakh centers have been established. It is a preventative healthcare mission. Here you are going to screen for BP, hypertension, BP, and diabetes. That means sugar. You usually say it's sugar, right? And then 41 crore teleconsultations have been done under Ayushman Arogya Mandir. And then our PMJ, very famous mission, right? It is a insurance project wherein 42.48 crore cards have been issued and 10.98 crore admissions have been done under scheme. Okay. Next scheme is PM ABM, PM Ayushman Bharat Health Infrastructure Mission. Under this scheme, 64,180 crore have been sanctioned to develop public health units for hospital beds and emergency healthcare units like ICUs and many other infrastructure required for a hospital. So that has been sanctioned under PM ABM. Okay, and then last but not the least, ABDM is Ayushman Bharat Digital Mission. In this mission, they have sanctioned ABA IDs, where every government hospital gives the registration process for the outgoing patients as well as incoming patients, and then they will be their records will be stored under ABA ID with the Aadhaar linking ABA ID. This is a digital health ecosystem wherein your records are stored. Whenever you visit with your ABA number, by giving your ABA number, your health reports will be automatically linked with the health records, and then they can be screened for whenever required, whenever you visit the hospital. So what do you have to remember here for the exam? You have to remember this is for primary healthcare screening and wellness, and 5 lakh insurance per family is sanctioned under PMJ. Ayushman Vay Vandana for coverage of universal, 70% citizens are covered under this. PM ABM, this much has been sanctioned for infrastructure of the hospitals, and ABDM for the digital health ecosystem and for ABA IDs in government hospitals and everywhere wherever you produce Aadhaar and ABA ID for your health records access. And then here we are, primary focus is about primary care, financial protection of the people, infrastructure and digitization. So this you have to remember for the exam. And then comes the famous polio vaccination. So on National Vaccination Day, that is which is observed on 16th March in 1995, polio day linked to Pulse Polio Day 1995. So the purpose of this National Vaccination Day is to remember and improve the immunization progress which has started with the Pulse Polio mechanism. The present coverage is 62% and we want to increase it to 98%. We want to reduce infant mortality rate. So what is Universal Immunization Program? So Universal Immunization Program has been launched in 1985. It covers around 2.9 crore pregnant women and 2.5 crore infants. So there are few diseases covered under this: tuberculosis, diphtheria, polio and many more. Okay. So what do you have to remember here for the exam? National Vaccination Day is observed on 16th March. It is linked to Pulse Polio program of 1995. Means India became polio free in 2014, and Universal Immunization Program was launched in 1985. It covers both children and pregnant women, and HPV vaccine was introduced. This is an extension introduced for cervical cancer prevention, and immunization cover in India is around 98%. It has increased from 60% to 98%. And then comes the famous Nobel Prize. Usually it is given in five areas. So one of the areas is physiology or medicine. Here it is given for discoveries rather than innovation. Okay, it was established in 1895 and it is awarded since 1901. Here maximum 3 Nobel laureates will be there. They will not be given after their expiry, and they will give medal prize as well. How do they select? Nominations they will be given nominations, and experts will review their nominations, and decision will be taken on those nominations. Okay, so for 2025, 3 scientists were given Nobel Prize on Physiology and Medicine regarding T regulation cells. So what is a T cell? So it will protect us from attacking our own immune system. So whenever T cells these regulatory T cells discover that attack is a mistake and protect the immune system from attacking its own body. Okay, that is how T regulation cells protect us from the immune system. So whenever one of the fragment is detected as a external agent, external microorganism, and our immune system starts attacking it, our own system, then these T regulatory cells will come in between and detects that this is our own cell, you don't have to attack it. So that is the role of T cells. So because of T regulation cells, they will our body identifies the attack is a mistake and protect us from the autoimmune diseases. Okay, so these T regulation cells are very important to protect us from autoimmune diseases and for cancer therapies and immune regulation as well. So what do you have to remember here for the exam? It was established by Alfred Nobel in 1895, and it was started giving awards from 1901. Who is awarding this? Karolinska Institute from Sweden. Maximum 3 will be given, not given after their death. A few exceptions will be always there. Okay, always remember, for any awards or any situation, there always be exceptions. So nothing is absolute, everything is qualified, remember. Okay, for every situation there will be exception. And award here, they are giving this Physiology and Medicine award regarding discoveries. Okay, and for 2025 it is for immune tolerance and regulatory T cells, awarded for 3 scientists, and it was held on 10th December. Okay, that's all for today. For detailed notes, please visit our website. For past videos, please check our playlist. For complete UPSC preparation, subscribe to our YouTube channel and follow us on Instagram and Telegram channels. Links are given in the description box below. Thank you.